this lecture we will cover the joints in the vertebral column, movement of the vertebral column, and in the second part we will talk about muscles of the back. Two main joints in the vertebral column, they are the joints between the vertebral bodies. This is secondary cartilaginous. It contains intervertebral disc. This intervertebral disc consists of two parts. The peripheral part is called the annulus fibrosus, and it is collagenous rings, and in the central part it is called nucleus bulbosus. It constitutes about 20 to 30% of the length of the spine. The second joint is between the articular facet or articular processes, the superior one and the inferior one. It is beneath synovial joint. Let's start with the structure of the intervertebral disc. The upper surface and lower surface of the intervertebral disc are covered by hyaline cartilage. It consists of mainly two parts, the peripheral part annulus fibrosus. It has narrow outer collagenous zone and the inner fibrocartilaginous zones. It consists of concentric lamellae or laminae. The fiber lies at an angle to the horizontal plane, about 25 to 45 degrees. The alternate layers are at right angle to each others. The nucleus bulbosus is semi-liquid, gelatinous, consists of mucoprotein content and its water. In the embryo, the nucleus bulbosus lie in the center of the intervertebral disc. However, during the growth occurs from the ventral aspect and the lateral aspect. That's why in the adult, the nucleus bulbosus is near to the back of the disc. Nucleus bulbosus constitutes about 15% of the whole disc. At birth, it contains 90% of its content is water. It will decrease by age. By old age, it will constitute about 70%. Herniation of the disc, herniation of the nucleus bulbosus usually occurs in the posterolateral direction. It will compress the spinal nerve at this part. If the herniation is in posterior direction, it will compress the spinal cord itself. It may irritate the nerve roots numbered 1 below the. The relationship of the nerve roots to the intervertebral disc at the level of the lumbosacral means the fifth lumbar disc. Fifth lumbar nerve here, root with its dural sheath, has already emerged from the intervertebral foramen. It will be hugging the pedicle of the fifth lumbar vertebra. So the nerve which lie obliquely on posterolateral relation with this disc is the first sacral nerve. So the first sacral nerve is liable to be irritated. By the same rule, when the fourth lumbar disc herniates, the fifth lumbar nerve will be irritated. When the sixth cervical disc herniates, the eighth cervical nerve will be irritated. The posterolateral lips, or we call it uncus, on the upper surface of the cervical vertebrae, starting from the third one till the seventh one, form a joint with the sides of the vertebra above. This joint contains a small cavity. This joint is called ancovertebral joint or Loschkat joint or neurocentral joint. They are considered as synovial joint, or they may be degenerative changes in the adjacent disc. Ligaments connecting the vertebra together. There are two main ligaments, anterior longitudinal ligament and posterior longitudinal ligament. The anterior longitudinal ligament is starting from the base of the skull, from the base occiput to the upper part of the sacrum. It is firmly united with the vertebral body but not with the disc. It is flat in the band. As it go downward, it will be broad. It consists of several layers, mainly two layers of thick collagen bundles. The superficial one bridges several vertebrae, however the deep one connects the adjacent vertebrae. It is well developed in the lordotic sections. It is more stronger than the posterior one. It is compressed in flexion, stretched in extension, and slack in neutral position. Regarding the posterior longitudinal ligament, it starts from the back of the axis. It runs inside the vertebral canal till the upper part of the sacral canal. On the reverse of the anterior one, it narrows as it passes downward. It has serrated margins. It is broad over the disc, to which it is firmly attached, and narrow over the vertebral body, to which it is more loosely attached to allow the passage of the basivertebral veins. It consists also of two layers, superficial layer and deep layer. It is stretched in flexion and slack in extension. Its continuation upward, starting from the base of the axis till the skull, is called membrana tectonica. We have mentioned before that the joints between the superior articular facet of one vertebra and the inferior articular facet of the above vertebra is synovial, plain synovial, that allow gliding. It is called the gapophyseal joints. Returning to the ligaments, ligamentum flavum. Ligamentum flavum is yellow, elastic. Yellow consists mainly of elastic fibers. It starts from the front of the vertebra above, of the lamina of the vertebra above, to the back of the lamina of the vertebra below. This partially flows in the midline, especially in lumbar region. In lumbar region, it consists of two layers. It is strongest in the thoracic region and weak in the mid-cervical region. It is always under tension in the neutral position. It is stretched by flexion, and in leaning forward, their increasing elongation become an increasing anti-gravity support. That's why it is under tension in neutral position. It resists hyperflexion. There are supraspinous ligaments. Supraspinous ligaments, they are strong, white, fibrous tissue. They are lax in extension, extended spine, and taut in fully flexed spine. It is indistinct below the fourth lumbar because of the presence of the lumbar fascia, and it is replaced in the neck by ligamentum nuchae. Interspinous ligament, those ligaments, interspinous ligaments, they are weak sheaths of fascia uniting the spinous process along their adjacent borders. They are well developed only in the lumbar region. They are stretched in forward flexion and slack in extension. They fuse with the supraspinous ligament. Intertransverse ligaments, they are ligaments connecting the transverse process of the adjacent vertebra together. They are stretched and compressed in lateral stretched and compressed. Let's move to the joints between the skull and vertebral column. The atlantoaxial joint, first atlanto-occipital joint. The atlanto-occipital joint is synovial ellipsoid. It is articulation between the superior articular facet of the atlas and the occipital condyles. There are two ligaments here, anterior atlanto-occipital membrane, this one, and posterior atlanto-occipital membrane. The anterior atlanto-occipital membrane, it is attached to the anterior arch of atlas and the anterior margin of foramen magnum. However, the posterior atlanto-occipital membrane attached to the posterior arch of atlas and posterior margin of foramen magnum. It is pierced by two structures, the third part of vertebral artery and the dorsal ramus of first cervical nerve. The movement is flexion and extension, the loading action. Muscles producing this movement, the flexion produced by sternomastoid, rectus capitis anterior, extension by trapezius, rectus capitis posterior minor and major, lateral flexion by rectus capitis lateralis, and also the joints between the first cervical vertebra and the second one, atlantoaxial joints. Atlantoaxial joints, there are two lateral atlantoaxial joints, synovial plane, and one median atlantoaxial joint, synovial. The median atlantoaxial joint, it is synovial pivot. The odontoid process articulate with a ring. This ring consists of anterior arch of atlas and the transverse ligament of atlas crossing at the back here. This is the transverse ligament of atlas connecting the inner part or the inner surface of the lateral masses together. The ligaments are cruciate ligament. Cruciate ligament consists of two bands, transverse band and vertical band. The transverse band is the transverse ligament of atlas. The vertical band connecting the transverse ligament of atlas with the clavus or basilar part of occipital bone above and to the body of the axis below. The movement on this joint is rotation. The muscle producing this movement is rectus capitis posterior major and inferior oblique muscle. Other ligaments, apical ligament connecting the odontoid process to the foramen magnum, two alar ligaments connecting the odontoid process to the occipital condyles. Those ligaments covered by the cruciate ligament, and the cruciate ligament is covered by membrana tectoria. Membrana tectoria is the upward continuation of the posterior longitudinal ligament starting from the axis vertebra till the foramen magnum. So, movement of the spine, flexion and extension, lateral rotation occur in the cervical, thoracic and lumbar region, and rotation, pure rotation occur in the thoracic region. Also, there is movement at the atlanto-occipital joint and atlanto-axial joint. Regarding the lumbar region, because of the shape of the articular facet, they lie in anteroposterior plane. They lock the rotation, so flexion and extension are free, and there is a good deal of lateral flexion. Thoracic region, the lower part of the thoracic region, the articulation between the last thoracic and the first lumbar one is lumbar in type, so it will allow also flexion and extension, and it will allow also rotation. The upper facet on the thoracic part, on the thoracic vertebrae facing backward and laterally, the lower one facing forward and medially. This allow rotation, but pure rotation, but actually rotation is restricted by presence of the ribs. In the cervical region, the upper articular facet facing backward and upward, the lower one facing forward and downward. The flexion and the extension occur freely, but pure rotation here is impossible. The range of flexion and the extension is increasing, starting from the second, the level between the second and the third cervical vertebra till the articulation between the fifth and the sixth cervical vertebra. Then it will decrease again in the articulation between the sixth and seventh vertebra. The normal range of movement of flexion in the cervical region is 80 to 90 degree. The normal extension is 70 degree. The normal range of lateral rotation of lateral flexion on the cervical vertebrae is ranging from 20 to 45 degrees. Regarding the thoracic and lumbar spine, the normal range of flexion is 90 degree, extension about 30 degree, and the normal range for side bending or lateral flexion and rotation is 30. The intervertebral disc is under compression all the time, so it attempts to expand, so it will increase the tension on the annulus fibrosus to resist the expansion of the nucleus bulbosus. The presence of the intervertebral disc allows the vertebra to tilt and increase the range of movement. Without presence of the intervertebral disc, actually the movement will be translatory movement. Lateral flexion is coupled with axial rotation. Regarding the movement occur in 3 translation and 3 rotation in 3 planes. The first one is side to side glide movement. Second one is superior and inferior translation vertical. Third one is anteroposterior translation. Regarding the rotation, there is side to side rotation tilting around the anteroposterior axis. There is rotation in transverse plane around vertical axis, and also there is rotation anteroposterior rotation or tilting in the sagittal plane around frontal axis. So in this lecture we have covered the 2 main joints in the vertebral column, ligaments connecting the vertebrae together, joints between the skull and the cervical vertebrae, the role of the intervertebral disc, structure of the intervertebral disc, and type and range of movement of the vertebral column. Thank you.